Hello, I'm Dr. Mario Vega Rich. I am a OBGYN and a specialist in reproductive medicine. We have a center with a group of very good professionals and other doctors that is called IVF Panama. We have been very successful in providing a nice family or the desired family that everybody wants when they go into form a family, that is to have a baby. And now we will be very happy to have you here in Panama to provide you with this happiness also. We have a center which is very dedicated to IVF. We have a program of donor egg for women that don't have enough eggs or they are already over the age to produce eggs for a family, and for couples that want to form a family. Also, we have a surrogacy program in case that there is an impossibility to carry on a pregnancy. So with this and a very great success rates in IVF, we have been able to do the best center for IVF here in Panama with the best results. The IVF, as you know, is a method in which the woman receives injections of hormones every day subcutaneously at home, and with frequent monitoring with levels of estradiol, which is a hormone that produces the follicles, and the ultrasound to measure the size of the follicles. We continue to decide which dose to give through the process of stimulation. And then once it reaches the point of good size of the follicles and nice levels of estradiol, we give an injection to mature these eggs and to release them. But just before they are released, we aspirate the eggs through vaginal ultrasound under anesthesia. We aspirate the follicles, and within the follicles there is fluid, and within the fluid there are the eggs. These are examined in the lab, in the reproductive lab, in the IVF lab, and the embryologist will select the eggs eventually that are mature to be able to do different processes to get the IVF or In Vitro Fertilization or ICSI. And then the next day it will be seen how many of these fertilize, of the mature ones, and we will follow them for 3 to 5 days before placing them back with ultrasound guidance in the uterus. This is done without anesthesia because it's a very soft catheter which doesn't produce any discomfort, just like an office exam. So in that way, the couple will be able to have a future pregnancy going on, and 12 days after the transfer, or the embryo transfer, we'll be able to know if you are pregnant or not. With this method, using the same equipment that is now in the best technology in the world, and the media that comes from different companies that produce them in the United States, we have a very sophisticated lab with very great results for IVF. Okay, the complications that you can see in an IVF process is mostly due to the stimulation, and it's called hyperstimulation. That's we try to avoid that with a method in which we don't want so many eggs, but what we want is the best quality of eggs. So we are not doing hyperstimulation in a way that the women are going to get complicated. We want to have few eggs, very good quality, and nobody wants in this stage of age multiple pregnancy. So the protocols that we're following now are minimal stimulation with great results. We get 3, 4, 6 eggs maximum, And with that, we are able to get very good pregnancy rates and avoiding this complication that was the worst of all. Infection, we prevent that with prophylactic antibiotics, which can be done, and we have never had a complication of bleeding, which is something that can be done, but is now in these days the needles that are used to aspirate the eggs are very, very thin in comparison with the old-time needles. They are now gauge 22 instead of gauge 16, which were very thick in the past. So nowadays we very, very rarely will have some discomfort, but not really complications that were frequently in the past with different protocols of stimulation. We have to get first lab work that are for infecto-contagious diseases like with syphilis, HIV, hepatitis. We have to check if the patient doesn't have any of these diseases, both partners. And also we need to know if the uterine cavity and the uterus is normal. So we don't want inside the uterine cavity fibroids, we don't want polyps. We have to do a hysterosonogram, which is a study that during an ultrasound, a vaginal ultrasound, fluid is placed inside the uterine cavity, and we will check if there is any defects in the uterine cavity that will prevent the embryo to get attached. The other thing is that if the woman wants their own eggs, we have to be sure that she has a good ovarian reserve. For this reason, we do some testing. We do ultrasound to check the antral follicle count. We do hormones, and we do a test that is called inhibin B. And in that way, we will be able to know if that woman has enough reserve to produce her own eggs. Otherwise, we will recommend her to get a donor egg to be able to have a baby. But we have to have a good uterus. Basically, even if she's menopausal, if she has a good uterus, she can carry on a pregnancy with donor egg. Normally we have, over the last years, a 52% success rate overall in all the ages. When we treat women that are young age, that's less than 30, we get over 16%. And when we treat cycles of donor eggs, we get close to 70%. So donor egg is the best cycle because the endometrium is prepared not with injections, but with oral medications and will not be hyperstimulated. And the embryos are usually from very young women, less than 30 years old, that are donated. And that is the best scenario to get a success pregnancy, but that's the best cycles. And the rest decreases with the age. More than 40 years old is very low, and that's because the woman produces less eggs, and many of these eggs are abnormal. So more than 40 years old, we usually recommend trying to have a donor egg, unless the woman is something that goes against her principles and wants to have her own eggs, then we go with her own eggs, but knowing that the success rate is less than 20% in those cases. It depends what kind of process is she going to be submitted to. A woman that is going to have a cycle can start the cycle in the United States with her own OBGYN with our own instructions. We will give them the protocol that we will have to do. And normally she should be here around the day 4th to the 7th day of the cycle. If she has somebody that has very good communication, we can go up to day 7 in the States, and then she comes back. Normally she will be aspirated around day 11 to the 13th. So she has to be here at least 2 weeks in that case. In case that there is a woman with that requires donor egg, she will have to get the prescription of the medications filled by her local GYN in the United States, and we will follow her with an ultrasound around the day 7 or 9 of the cycle, and we will tell her that she has to be here around the day 10th or 11th with her partner, so the partner will provide the sperm to fertilize the donor egg, and she will have to stay here from the day 10 to around the day 20th, around 10 days or 7 to 10 days here in Panama. And once we have been transferred, she has been keeping a little bit of bed rest before flying back to the States, and with the medication that she will require for the first weeks of pregnancy and with instructions. Normally in Panama is 10 days in those cases of donor eggs. So in general it's around 10 to 14 days what they require. If they want to have the complete cycle from the beginning to the end here in Panama, is around 21 days. That's from the first day of the period or the first day of the starting of communications to the day of the flight back to the States. Well, Panama is a beautiful country. We have a lot of attractions in this tropical area with a beautiful canal that is expanding, and with nice people that will make feel you at home from the day one that you come over here, and to feel that you are not in a strange area. We are very close, and we are providing a very nice setting, so you will feel very confident and very happy to be able to have our cycle of IVF with us. And we know that we have a great success, so we can help you to get your dreams fulfilled.